All right, I think we'll get started at 7:30. My pleasure to introduce Dr. Heidi Otter. Thanks, Heidi.
Great, thank you. And thank you everybody for joining us this morning. It's a welcome and a shout out to the podiatric surgeons joining us today. This is our second webinar of what we hope will be a few webinars. And the intent is to ensure that you understand what will be required of you as we transition to one college and you will be registrants of the College of Physicians and Surgeons of British Columbia. Just to recap, our first webinar, we gave an overview of the college, our role in the regulation of the medical profession broadly, and our public interest mandate, the Health Professions Act as it is set out, and an overview of the committees. And just to remind everybody that the amalgamation date is effective August 31st, 2020, and the new college, College of Physicians and Surgeons of British Columbia, will be regulating physicians, surgeons, and podiatric surgeons. I'll take the next slide, Courtney. Thanks. So we'll start by acknowledging that the College of Physicians and Surgeons of BC is located on the unceded and traditional territory of the Coast Salish peoples, including the Musqueam, Squamish, and Tsleil-Waututh nations. And I will note that I today am physically located on the ancestral and traditional territories of the Squamish and Lillooet people. Thank you. Next slide. So as we did last time, we've collated your top 5 questions as have been coming in on the email box to the college. I just want to remind everybody that the questions and the answers to those questions are part of an FAQ web page that you can access on our website and the CPOD's website. And I won't go over the questions here today, but just to remind everybody that this information is available, and please continue to send us your questions. We really want to make sure that this transition is supported as much as possible prior to August the 31st. I'll take the next slide there. Great. So to remind everybody, the email box is cpodsbc@cpsbc.ca. Please send us your questions. Your questions are important to us. And again, we want to be supportive, timely, and clear with the transition and to provide you with as much information as you need to feel comfortable in that transition process. As I said, we have an FAQ section on our website, and the URL is listed for it there. I encourage you to bookmark it. It is being updated frequently, and it will evolve as we receive your questions and provide further information. I also want to say that for this webinar, we will be enabling the chat function of the Zoom platform. So please use that if you have questions. The questions will be monitored by the Communications and Public Affairs staff, and we will be answering them at the conclusion of this webinar. So again, the ribbon at the bottom is where you can send in your questions on the chat function of Zoom. I'll take the next slide. We thought it was really important to just highlight the role of the association versus the role of the regulator. And many of the questions that we've been receiving at the college are really, in our view, appropriate for the BC Podiatric Medical Association to be answering. They are not really regulatory functions. So just to remind everybody that a regulator does not advocate for the profession. It does not negotiate fee benefits or other things like that on behalf of practitioners. The role of the college is to regulate registrants to ensure patient safety and public protection. We do that at the individual level under the authority of the Health Professions Act and its bylaws. Obviously, one of the biggest functions that we have is addressing complaints that come from the public, patients, about the care that they have received. And every person who works as a member of the profession is required to pay an annual fee, and licensing is mandatory in order to be a registrant of the college. The kind of functions that would typically fall to the medical association would be advocating, negotiating, professional satisfaction, economic reward, and payment of a fee to that association is optional. I'll take the next slide. So the focus of today's webinar is really an introduction to practice standards and guidelines that you as registrants of the College of Physicians and Surgeons of BC will be required to be knowledgeable about and adhere to. When it comes to our policies, if you like, I can divide these really into two very large buckets. On the left-hand side, you'll see highlighted in gray there what we call our general policies, and these are a series of practice standards, professional guidelines, and legislative guidance that focus on ethics, professionalism, and high-level expectations of registrants of the college. We're going to be focusing on those today. On the right-hand side, you will see what we call our program-specific policies, and this will be the topic of a future webinar where we will get into much more detail around expectations with the non-hospital medical surgical facility accreditation program, our peer practice assessment program, as well as our program around audits of medical device reprocessing standards. So again, this the future session will go into much further detail around the program-specific policies, and today we're just going to be looking at the practice standards, professional guidelines, and legislative guidance. At this point, I would like to do a shout out to Dr. Dana Alamba and Dr. Francis Chan, who've been working with our Communications and Public Affairs Department to harmonize, standardize, and streamline the existing standards of the podiatric surgeons to align with ours. So I will take the next slide. So I just want to acknowledge that we have standards that don't apply to every single physician in the province. And likewise, there are probably some standards will not apply to podiatric surgeons. Examples would be medical assistance in dying. Not all physicians provide that service, and that's obviously not within the legal mandate of podiatric surgeons. But it is important that you become familiar with the standards and guidelines that are on our website. Once you are actually formally registrants of the College of Physicians and Surgeons of British Columbia, you will receive an email every time we have an update to guidelines, and you will also receive our electronic bulletin that comes every 2 months where any revisions or new standards or guidelines are highlighted in that educational tool. I'll ask for the next slide, Courtney. Thank you. So, and these are important definitions. A standard reflects the minimum standard of professional behavior and ethical conduct on a specific topic, and it is legally enforceable. These are really musts. They're not nice to haves, they're must haves. And these are just an illustrative list. It's not exhaustive of the kind of professional standards that we think you should be knowledgeable about. The first is access to medical care, and we've made it very clear that we've articulated human rights expectations, and essentially it is important that patients are not discriminated in accessing medical care. The other ones listed here, advertising and communications with the public. It is important that any advertising be truthful, that you aren't suggesting that you get better results than others, and that information is factual. We have an expectation around boundary violations. It is important that all registrants of the college understand that they can only have one relationship with a patient, and that is a practitioner-patient relationship. And it's inappropriate to have friendships, business, or other type of relationships with patients. It's an abuse of power. We have expectations around leaving practice, expectations around medical records, and flowing from the Canadian Medical Association Code of Ethics and Professionalism, an expectation that it's inappropriate to treat yourself, family members, or your friends. So again, an illustrative list only. All of this can be accessed on the college website, and I would encourage you to become familiar with these standards. I suspect many of them you are already familiar with because they are very similar to standards that you already had published through the College of Podiatric Surgeons of BC. I'll take the next slide. Thank you. The next group are what we call professional guidelines. So these are recommendations for what is expected of you, but you may use reasonable discretion when implementing the guideline. And examples include expectations around use of photography, video, and audio recording of patient interactions, the existing referral consultation process, and expectations around social media. And I just want to say that if in fact you are going to be departing from recommended courses of action, we would expect to see the rationale for why you're doing that noted in your medical record. I'll take the next one. The last sort of general type of information that we would have on our website to guide people's professional and ethical conduct is legislative guidance. And I think it's important to note that there are a number of legal framework statutes that exist at either a federal or provincial level that you are expected to comply with. And part of being a registrant of the College of Physicians and Surgeons of British Columbia is an expectation that you will comply with the existing legislation. So, and again, just some examples, duty to report. This one flows directly from the Health Professions Act, and there is a statutory duty upon all regulated health professionals to report certain types of concerns to the appropriate college. The other legislation that you are expected to comply with is the Criminal Record Review Act, and you have an obligation, should you be charged with something criminally, or convicted of something criminally, you're required to self-report to the college as a legal obligation. The last one I wanted to comment on was the Infants Act. Again, this is a BC statute, and it sets out an expectation that an infant can legally consent to health care, provided they meet the requirements set out in the Healthcare Consent Care Facility Admission Act. And all of that to say an infant is a person under the age of 19, so somebody who's not of legal age. But if they have the capacity to understand the risks and benefits of a particular medical interaction and have the ability to understand all of that, they have the legal right to consent to that. So, for example, a 16-year-old may attend at your office and wish to have an ingrown toenail managed surgically, and you don't necessarily need to have the parental consent to go ahead if you can satisfy yourself that the infant has the capacity and ability to consent under the existing Infants Act in BC. Changing course a little bit here. Now I'm just going to give you an overview of how standards and guidelines are developed at the college. We have quite a robust process and one that we're really quite proud about. When Harry Caton was here in British Columbia talking about ways to modernize and improve professional regulation in British Columbia, he made a very pointed comment that the public that we serve need to be part of our regulatory processes, and we have embraced this and really bake this into how we develop standards and guidelines at the college. And the first step of this, as you'll see at the very top, it says an issue is identified. And again, standards and guidelines are foundational, and they're really at that 40,000-foot view. We don't get into the weeds, and we don't do clinical practice guidelines. But there becomes issues that we can have concerns raised. We may identify it through a complaints process, and what we do is ask ourselves, do we need to have a standard or a guideline to address this issue? We have a team of people at the college who've got the ability to go and do some research. A lot of our research is really developed around checking other peer regulators' websites and emerging issues through our connections with, say, the Federation of State Medical Boards or the International Association of Medical Regulatory Authorities, or our relationship with CLEAR, the Council on Licensing, Enforcement, and Regulation. From that, we will potentially develop a policy and then go to a formal consultation process. Our consultation process includes consulting with every registrant of the college, our peer regulators in British Columbia, our peer medical regulators across Canada, as well as a targeted consultation with members of the public. And we have really enhanced how it is that we actually connect with the public to make certain that their views, their positions on these are considered and incorporated in our standards and guidelines. And I just want to acknowledge in the last year, we've been developing and implementing a public advisory group to assist not only our college, but many of the other sister colleges here in British Columbia, and making sure that that patient voice is captured in our existing policies. We also consult with the health authorities and the Ministry of Health and other key, depending on the topic, other key stakeholders such as the Canadian Medical Protective Association. Once that consultation phase has been completed, the policy is then finalized and it's taken to the board as a final step for approval, and then it is sent out to the profession, put on the website, and broadly disseminated. And then on a regular basis, all of our policies are evaluated on a 3-year cycle, and then if need be, revised to meet public's expectations. I'll take the next slide. So with the advice of the Transition Steering Committee, we will be sending to you batches of standards and guidelines that we want you to review and familiarize yourself with. So far, we have sent out to the podiatric surgeons one practice standard and 6 professional guidelines for your review. We will be continuing to send these to you to highlight relevant practice standards for you to be thinking about in your practice. And again, future webinars will look to address specific standards and guidelines on more complex matters throughout the rest of the summer, and likely beyond the August 31st amalgamation date. And examples of standards that we will be addressing in future upcoming webinars include conflict of interest, sexual misconduct, and non-sexual boundary violations. So again, an ongoing program. So what's next? Let's go take to the next slide. We will be having additional webinars where we will be going over our quality assurance programs, our accreditation programs, specific standards and guidelines arising from our accreditation programs, and any other topics that are of interest to you. Again, I think it's very important that we hear from you. I encourage you to be checking our amalgamation webpage and sending us your questions at the email address that I referenced. And I just want to remind everybody that the bylaws for the amalgamation are posted. They have been revised along the way, and we appreciate your feedback. We would want to receive your feedback, however, by August the 28th, 2020, which is when the consultation closes. I'll take the last slide. So again, send us your questions. Your feedback is really important to us. We want to make this transition as smooth as possible. So cpodsbc@cpsbc.ca. Want you to make sure that you are checking our website for the FAQ section. Our webinars are being recorded in a YouTube format and are available to be viewed if you've missed any of our webinars, and the website content will be updated as we go. So at this point, through the magic of the chat function and texting, I will attempt to get at some of your questions. Susan?
I just texted you, Heidi.
All right. So, will a physician at the college be willing to work with the BC Podiatric Medical Association to advocate for us and get us access to pathways and advocate for us with the ministry. Our association is very limited with resources. Maybe just for this period of transition, this will improve patient access to podiatric surgeons. Well, again, I think it's really important to know that the college is not in a position to advocate for the profession. And I appreciate that professional advocacy is an important, it's an important task for you as podiatric surgeons. What I can do is work with your current board chair and Dana Alamba with through the transition steering committee, just some advice, maybe just some names. I can give you at least some names of people for whom maybe it would be useful to network with. But I must say that it's really important that the college stick to its knitting, which is regulating the profession in the public interest and not confusing or blurring those responsibilities by advocating for the profession. So the next question is can we still sell over-the-counter products, shoes, sanitizers, topical ointments? Yes, but you are expected to comply with the college's professional standard regarding selling devices and products. And we will certainly make that a topic for a future upcoming webinar. The next question is about the referral consultation guidelines. And the question is, will podiatric surgeons be able to directly refer to other specialists without sending the patient back to the family physician? I will actually see where this is at with the Ministry of Health. My understanding is that nurse practitioners and midwives have some ability to send people to specialists. And while I can't say that I can advocate, I can at least look into it and see what the ministry's position is on that. So the next question is when were the practice standards sent out? And the answer is that the email was sent out to registrants in early July. I encourage all of you to have your own unique email address and check it frequently. Email communication is important, and in today's day and age, communications are all done electronically. We're really trying to do away with snail mail. Next question, cannot find the requirements for the Class 3 surgical facility. The answer for that is if you look under the non-hospital medical surgical facility accreditation program section of our website, there's a tab at the top of that, and you should be able to find the requirements there. Next one is, can you say more about Infants Act and consent? Yes, I can. So in British Columbia, the Infants Act says that an infant, and that's a bit confusing because an infant is basically anybody who's not adult or age of majority, can, in certain circumstances, consent to their own health care. So it's really about consent. And I think it's safe to say that the closer a medical act or procedure is to being high risk, the more likely you are to require that child to actually be an age of majority. There's the concept of an emancipated minor. And I think it's a judgment call, and it's the kind of thing that if you have questions, we do have physicians on staff at the college who can assist people in how to navigate some of these tricky legal situations, but we also recommend that people check with either their insurance company or legal counsel. Can you give us an update after you meet with the orthopods who sent the letter re-surgical privileges? The answer is yes, we would certainly do that. And as you know, your board chair, Ken Stewart, and one of your board members, Dr. Dana Alamba, will be joining us for that meeting. I appreciate that was an inflammatory letter, and just to say that I've already been in discussion with the Associate Deputy Minister of Health, Dr. David Byers, about the content of that letter, and sent him some material to assist him in understanding where that letter from the orthopedic surgeons was not factual. Susan, do we have any other questions?
Just one more, Heidi, I'll read it to you. Will you will you talk to BCMA? Their requirement for membership is physician registered with CPS, which we will all be, and it allows us help the way the college amalgamation helps us, or provide our board with a name at the association.
Yeah, I will certainly reach out to my colleagues at the Doctors of BC, send them an email telling them I'm interested, and find out who at the association you should speak to. So I will do that and get that information back via the Transition Steering Committee.
Thank you, Heidi. That's the last question.
Great. Well, again, I want to thank you all for giving us some of your time this morning. This webinar will be repeated this evening at 6 o'clock, if you could possibly stand hearing from me again twice in one day. Again, your feedback is really important to us. We want to make this transition as smooth as possible and set you up for success once you are registrants of the College of Physicians and Surgeons. And I also want to thank, again, the members of the Transition Steering Committee, and in particular, Dr. Dana Alamba and Dr. Francis Chan, who've been working hard on the standards and guidelines portion of this transition. And again, I want to thank Susan Prins and her team at the college who are assisting with the transition as well. So over and out, and we'll be in touch in a couple of weeks with our next webinar related to accreditation. Thank you very much.